I would like to welcome our next speakers, Susan and Stephen. They're going to take us a little bit into the world of outpatient counseling and therapy and talk about how they support clients, teach coping skills, and help people create some lasting change. So welcome, Susan and Stephen. I am happy to jump right into kind of a QA with some of my questions, or if there's anything that you'd like to start off by sharing just a little bit about yourself and your history and how you got into your role, we can go there.
Sure thing. Thanks so much, Alicia. Stephen, why don't you start?
All right. I'm Stephen Kornoely. I am a licensed social worker, master's of social work. What got me into the field, I'll go with the short answer because I can be long-winded, and Susan knows this about me. I got my bachelor's in psychology and Spanish at Aquinas. Did some work with refugees, went to grad school at MSU, got my MSW, did in-home work in Kent County and refugee work kind of at the same time, providing in-home therapy to families on Medicaid. And then I came to Pine Rest, where I work now, and I was an outpatient therapist for a couple years. And then right before COVID, I became clinic manager. So I both provide therapy and manage my clinic. And that's where I'm at.
Where is your clinic, sir?
Oh, yeah, sorry. I'm at the Northwest Clinic, which is the northwest side of Grand Rapids, near 3 Mile and Walker, close to Alpine, for those who know where that is.
Cool, thank you. Do you have any specialty in your treatment of patients?
Oh, yes, thank you. I didn't want to go all in it because I was going to speak too much, but my specialties include dialectical behavioral therapy, which is a evidence-based treatment for people who really struggle with emotion dysregulation, typically for people diagnosed with borderline personality disorder, but also for that emotion dysregulation difficulty. And then I also utilize emotion-focused therapy, which is a evidence-based practice for working with couples.
Cool. My name is Susan Bergman, and I've been a social worker for, I don't know, maybe close to 30 years or so. I came to Pine Rest out of private practice, in part because I love the flexibility of private practice. But you're kind of a lone ranger. And I really, when I got to Pine Rest, I work at the Holland Outpatient Clinic. And there were colleagues to collaborate with. And right down the hall, there's a prescriber who can support my patients through medication options. And there was just a whole lot of resources and support I didn't have in private practice. I was like, what took me so long? I'm really glad to be here. And I am specifically a trauma therapist. I have a toolbox full of modalities that are useful in treating trauma, not the least of which is a therapeutic practice called EMDR, eye movement desensitization reprocessing. But certainly that's not the only way we treat trauma these days, but it is pretty effective. And one of my favorite things to do as the manager here at Holland Clinic is to take limited licensed clinicians and help them grow up into a terrific therapist. And if, that's part of where your students are going, I would look forward to having conversations and encouraging them in that process. This is a beautiful career, and the opportunity to work with people seeking help and support is just a gift every day. So.
Fabulous. Thank you for sharing that and providing kind of those specialties. I want to dive a little bit more into those in a second, but I'll start off with kind of just basic. What does a typical day look like for the both of you? Those are very unique specialties. We did have a group earlier who dealt with the more community mental health aspects of things. So just tell us a little bit more about what the outpatient looks like for you.
Cool. So my outpatient therapist usually carry a caseload of anywhere from, if they're full-time, 60 to 100 patients, perhaps. Most of us are seeing around 6, 7 people a day. Certainly there's some wiggle room there, depending on how you want your schedule to look. But we see individual sessions. Some people are treating children, adolescents, adults, or seniors. We typically have an age range that is like our area of expertise. And I know that Pine Rest does a great job of kind of helping us have a specialty so that we're providing the highest level of care, and so that we can read research and get continuing education and really begin to hone our expertise in treating particular patient populations, age groups, or therapeutic issues, whether that's, anxiety or trauma or OCD, bipolar, like whatever that might be. I think probably as a general rule, when people think about Pine Rest, they think about the hospital, right? Like inpatient treatment. And one of my favorite things about working for this organization is there is such a wide spectrum and range of services provided here that no matter what's going on with you, there's probably a way to get your needs met, right? So you can do outpatient where you come once every 2 to 3 weeks or every 6 to 12 weeks if you're in maintenance or whatever that might look like. You can have intensive outpatient where you get seen more often, sometimes 2 or 3 times a week. You can have partial hospitalization where you still sleep at home, but you go receive services, group therapy, and individual and support, a few hours every day. Or you can be inpatient, and lots of other things, substance abuse treatment. We have residential treatment for people with developmental disabilities. There's like a gamut of services. And so that really helps my patients feel like we can work together as a team to take a good care of them. So a typical day is, checking out who's on your schedule, seeing your patients, maybe having team meetings or supervision, staff meetings, that kind of thing. And there's documentation, right? We each have an hour or 2 every day sitting in front of the screen entering data. Stephen, what would you add to that?
No, well said. I think that encompasses a lot of it. I think the only thing that that adds, especially in like a group setting, it's a bunch of us. So like when there's time and you need to consult or you need to pick someone's brain, or we have psychiatry at our location, so sometimes it's like, hey, I'm gonna quick chat with the psychiatrist real quick about my patient and update them on the situation of what they're going through, or collaborate on care of like the next steps of the plan. Or there's a lot of time for both the work, learning and consulting and working together, but also fun stuff too, right? So like, people might come by my office and want to just chit chat and laugh and joke about something, right? Like earlier today, as an example, like one of my coworkers sent out a bracket for March Madness, and everybody like quickly joined and created a bracket. I don't know much about basketball super well, so my bracket was really people gave me a lot of grief about it. But like there's fun right in the downtime in between the work. But that's the only thing I would add, is that like kind of random collaboration that can happen with your team.
Yeah, and both Stephen and I lead group therapy, right? So like we each run a couple of groups. Stephen's for DBT, right? And mine for trauma and substance use.
Oh, that's perfect. Thank you. I appreciate that there's such a variety of different aspects to your role. And I really love to hear that there's such a collaborative feel to what you're doing. A lot of the times, maybe many students only experience social workers in the context of a school where they're maybe interacting with, a counselor or a school psychologist. So it's great to hear that there's that collaboration across professions in kind of that community clinical outpatient setting as well. So building upon that, knowing that maybe the only social worker that our students may have ever interacted with is in that school space, can you tell me a little bit about how you set down the path to becoming a social worker, and then how you then further specialized into these very unique areas, and Susan, you specifically had mentioned that Pine Rest kind of helps clinicians and their professionals specialize in that. So if you can speak to that and
Sure.
add in any extra additional context and information, that'd be great.
Cool. Stephen, you want me to go first?
Yeah, go. I mean, she gave you a good segue, so that's a good place to start.
I think I was made to be a social worker. I actually had a psychologist as a dad, and he did a beautiful job role modeling being in the helping profession, but he was very concerned with cognitive function and how people think. And did some beautiful work there. But oftentimes his patients would go back to environments that were chaotic and unsafe. And so then there, from my limited perspective, right, then the work seemed to be kind of missing, addressing all the complexity. And it's one of the reasons why I chose social work, because this is about the person and environment. I care that I need to help you with anxiety or the way that you think or with depression. But if you don't have enough food, I know like this higher level work isn't going to be possible if you're not safe at home or if you don't feel comfortable in your community. Like all those factors really matter to me. And so social work is like this more holistic approach to person and environment. And I'm going to make sure not only my evaluation, but my treatment is going to address all those contextual issues. And that's what's magic, I think, about social work. Stephen?
Yeah, so I have a similar kind of funny story in a different way. So my undergrad was in psychology, and I love that cognitive stuff. I love the idea of like trying to understand human behavior, which is probably why I lean into DBT, which is a very behavioral type of therapy. But my uncle is a therapist, he's a psychologist, and he said, don't be a psychologist, be a social worker, because it's better for paneling with insurance. And I go, oh, okay. And so like I kind of didn't know so much about, like I had a concept of what social work was, right? And then when I went to school, it was really cool because the way what Susan said so well about like taking in those whole contexts, like that speaks to me. Like I didn't like, so like in my first classes, I was like, this makes so much sense. Why weren't we talking about this? Or I remember times like in my program, we would be talking about stuff like in my undergrad, and I'd be like, well, aren't we considering this? And then people are like, no, it's about the individual and what, whatever. And I just love that piece of like taking in all social contexts, the environment, everything, right? And it just makes sense to me, and so that was really helpful. And so what brought me was I just took the direction of my uncle, and because I trusted him and stuff, and then it turned out that it was like exactly the right fit. And then, speaking to what you had said about some of the specialty stuff and the stuff that Pine Rest offers, I can speak to that a little bit too in my experience, because some of I would say being a therapist, in my experience at least, is you kind of start off general, and then you don't really know what you like until you try it, right? And so having opportunities to try different things, working with different people will help give you that idea, right? And so that kind of develops over time. And I was fortunate that the clinic I worked at had a DBT program here. And when I got hired, the coordinator at the time was like, I want him on the team. And then they slowly tried to convince me to join. And then I did. And I was like, oh, I love this. This makes sense to me. And then, and that was that, all that training and supervision was all covered for. I got to go and get trained be a behavior tech in Seattle, which is Marshall Linehan's like company. So that was super cool. And then I fell into couples work because a clinician that worked here at the time wrote a grant to get us to offer essentially an externship with emotion focused therapy for levels 1 and 2. And so I signed up, I got in, and I did that. It was like 40 hours for the first level and 40 hours for the second or something like that. And that was all covered. Like I had to pay $0 for that, where normally that would have been thousands and thousands of dollars probably. And I, luckily I did again, I was like, this sounds interesting, I'm going to look into it. And I went to the training. I was like, this fits me as a person and my style already, that, it speaks to me. And so like, and then luckily we get professional money to spend on trainings and stuff. And so, I know Susan's talked about EMDR, and that's something that I want to explore. I just want more time to explore it, because everyone who does it loves it. And I'm like, it's like a party happening that I want to get invited to. And
You have FOMO.
yeah, and I want to get invited, and I just don't have the time to fit it in my schedule yet. But like the nice thing is we have the opportunity to explore that. Whereas other places I've worked, if I asked to go to a training, I'd probably be laughed at and be like, you have to figure out how to make that work. Where here it's like I'm supported to grow and I'm supported to learn, which I love, because I love to learn. So, it's super great.
There's part of our contract as clinical therapists, there's a pot of money to pay for continuing education, but there's also 5 days a year that that you don't use your PTO, you don't go unpaid. They actually pay you to go to the training. Travel expenses can be included in that. It's a generous package. But when I have a new clinician, I will kind of control like what kind of patients come to them, and it will be kind of generic, low-level mental health symptomology, not acute cases, right? And then slowly get to know them and see how they work and what their strong suits are, and like help them lean toward a specialty. So in my office, I might have someone who's really passionate about play therapy with kids, or doing like exposure therapy for OCD, so someone who works with kids on the autism spectrum, or adults, right? Or attention deficit. Like you just begin to find your way. And sometimes it's our personal or life experiences that inform that. Other times it's because we're captured by a training or a speaker or a book we've read. But there's people to kind of help you on that process. If your only experience of a social worker is like a school social worker, I think that's one of the beautiful things about social worker that's so broad, right? You can work for, a government agency, for a nonprofit organization. You can do clinical work. You can be in schools or criminal justice. I mean, there's just no end to the options. One of the reasons why I chose clinical work is because I think most of us are voyeurs. We always want to know more about why people are the way they are. And if you find yourself the kind of person that someone talks to and tells secrets or shares their problems, and you ask follow-up questions, you might be geared for clinical work, right? And also there's a lot of flexibility in this way of using our degree. So like when I was, my kids are all grown now and adults themselves, but when they were little, I could see patients only during school hours and still drop them off and pick them up. Like it just offers a lot of flexibility that was super meaningful to me. You can see more patients or less depending on your tolerance for the intensity of the work. There's just a lot of choices and freedom I think we have to shape our careers in a way that's super beautiful.
That's great. And that brings up a couple of questions for me. The first one being just kind of maybe for students who are dropping in and not super familiar. One of the things that I hear is you're providing therapy and counseling, and knowing that there are other professions like psychologists and actual counselors as a profession who also provide those services. How would you say your counseling and therapy may differ than those other professions, just to help kind of highlight the differences between those professions?
That is a great question. And when I have this clinical staff, right? Let's say I have 20 therapists in my building. Probably a third of them are LPC, licensed professional counselors. A third of them might be MSWs, right? Social workers. And a third of them might be either limited licensed psychologists or doctorate level psychologists. And we are all doing the same kinds of things in the room, right? So in some ways, you might not be able to tell the difference. I'm not going to lie, I'm always going to be partial to social workers, in part because of some of the dynamics we already mentioned about being more holistic in person and environment. But there's definitely unique skill sets for psychologists versus social workers. And that's why collaboration and working in a team environment is so useful. Stephen, what would you add to that?
Yeah, I mean, it's hard because like words get through, like counseling, therapy get thrown like, and we use them interchangeably and stuff. And I think too, like even you might hear the word like psychotherapy thrown out a lot. And I think that's in a way to try to get people to distinguish like us here, like me and Susan, as what most people would think as a therapist. But then when you say therapist, someone goes massage therapist, physical therapist, right? And so like counseling in the terms of in regards to mental health is essentially the same thing as therapy. It's just a different word. The different career pathways that bring you down, you will be doing the same work. I would just argue that you might come in with a different perspective of how you might first approach a patient. And if you're working in an environment alongside different people with different background, you start to like really build and pull their strengths and pull that into your perspective as well. So like, when I work with psychologists, like, especially newer ones that haven't been in the field, like I help orient them to the environment and how the environment might be impacting the patient, where like they might not have thought about that as often as I might. And even a lot of social workers have, in my experience at least, will have experience working in systems that treat or are part of social welfare systems, where like a PhD psychologist might only have outpatient therapy experience, so they don't know necessarily how the other systems interact and work. And so we can bring in a lot of context that helps them understand the continuum of service or care, or where someone starts and might end, which I think is also really great. And you know, a person who is 10 years in, regardless of license, is probably very similar in what they're doing at the end, because it's really the work itself. Like education is obviously important; it's necessary for our license, and really you get the experiences where you start to bloom and grow as an individual, and that's where your practice and skills really come out. Because you can't teach that stuff super well in a classroom because it's books versus meeting with people, right? It's the difference of, book smart and street smart, and it's the melding of the two over time that really strengthen the person.
I'm so glad you said that, right? Like we do need a foundation. We need to read the books and take the classes, but we also use ourselves as the tool. There's like the soft skills, right? The people stuff. And like sometimes that's harder to teach. And I want both. I want you to be as informed and educated as you can be. And I also want you to know how to be creative in the room. And so in tune with and aligned with your patient, that an intervention might just come to you specifically designed for, whatever's happening in the moment. Practically speaking, there are some differences. Like in LPC, it's like a fast way to get into the field. But like one of the things I'm thinking about as a manager is that there's zero requirements for ongoing education in order to keep your LPC, your license. Whereas social workers have to get, 60 credits of education every licensing cycle every 3 years. So it's like it's built into the degree, to the license, that we know you need to keep learning and growing. So when I'm managing and supervising LPCs, I'm like, I know you don't need to for your license, but you need to for me. I need to see you like that you're still learning and growing. And the same is true for psychologists, right? That they have licensing requirements to keep expanding. If you are pursuing psychology, you pretty much need a doctorate degree. And I can do the same things with a master's degree in social work. So like that's a practical reality. I do have a few limited licensed psychologists, but the insurance paneling is a little bit trickier that way. So it's just personal choices and opportunities. But I don't know if that answered your question well enough.
Yeah, no, it did. And I really like the note, Stephen, that you had about it's perhaps a difference of your perspective when you're first initially treating a patient or having that first interaction. So thank you for that. I think that was really helpful. The second question that I brought up, one of the things that's kind of been a reoccurring theme is this idea of experience and experiential learning. Like, you don't really know exactly what you want to do until you've had that chance to experience it. Some of our previous presenters talked about learning about different opportunities through their internships or their rotations. From your perspectives, knowing that you know, Stephen, you had all these opportunities to kind of like experience these different modalities of treatment. From the high school student who is thinking about what they want to do, perhaps what kind of undergrad they want to do, maybe they know they want to help somebody, what are some ways that they can go about to get some experiences, to dip their toes in the water so that they can kind of, you know, cross things out of like, absolutely not, I don't want to do this, or this kind of piques my interest. Maybe I want to pursue this a little bit more in post-secondary.
Yeah, I mean, there are a lot of, I think for if you're in high school, volunteer opportunities, right? That's a good place to start. There's not a lot of, I can't think of places that hire high schoolers in the mental health field. But once you've graduated high school, and Susan, if you have things that come up, let me know. But I think of like, we often will hire high school graduates for like people who work in the hospital as kind of, they're called psych techs, and they work with people who are in the hospital, support them while they're there. You know, I've had experience of one of my staff who I work with started here as administrative staff, you know, navigating phone calls and helping clinicians. That was a way for her to dip her toe in the water, and then she went to grad school, and then she became a therapist and stayed all at this clinic the entire time. And so there's, you know, but I would say volunteering for high schoolers is definitely a one. You know, there's lots of, you know, with the internet now, there's lots of good stuff out there, like watching, there's lots of videos, you can look into stuff, right? See how things kind of go. And some of it is kind of finding ways in which to kind of grow that part of yourself if that's something you're interested in. Because you might be like, oh, I want to work with people, but it might be in one way, or it might be in a healthcare setting. Like as an example, I had initially thought about like nursing or being, you know, like a pediatrician or something, right? Because I like working with people. But then I was like, I don't want to go to school that long, and that sounds expensive. And so, you know, but part of it.
It's a little known fact. I'm a trained phlebotomist, right? The same, same kind of idea.
Yeah.
I would think interview people that you respect or that you kind of dive with. Ask them, what is it that you do, and how did you decide that, and what training was required, right? Like, be talking to your parents, friends, or to adults in your life or teachers. Just keep having conversations, because that will help too.
And I would add, like, if this type of field is something you're interested in, I think I'll speak specifically to social workers. I think most of us, because of that like big environmental context, if I had a high school student call me and say, I want to ask you about what you do you have time to talk? I'd be like, heck yeah, call me. Over. Yeah, well, we can talk. I can tell you all about it. Right? Like I think you might get some people that are like, I'm really busy, I can't. But I think many social workers will be like, I'd love to create time to talk to you. You know.
No, that's great. And I appreciate you sharing that, because I think sometimes it can be intimidating. Like, you don't want to seem like you're pestering somebody. So I'm glad to hear that it is something that, you know, if someone called you up out of the blue, it's not going to be like an absolute no. Sometimes it might be depending on the season of life, but no, I think that's great.
Oh, Alicia, the only thing I wanted to mention to your students is that I checked the pinerest.org website today, and there's 135 open positions available. And even just going to the website, clicking on careers, available jobs, and looking at all the different, like the variety, Many of them, all you need is a high school diploma. Some of them require ongoing, education or a degree, but just to take a look at some of the job titles, you'll be inspired at what kinds of ways you could get, next steps.
Yeah, I mean, even a foot in the door, it sounds like specifically Pine Rest might, different than other employers, might have opportunities to help facilitate the growth of that person through school. So perhaps there's an opportunity for an earn and learn model. I won't say that for certain, but definitely something for students to check out. All right, I know we're up at our time, so I'll just open it up to either one of you if you have any last things that you want to mention to our students. Otherwise, I'll thank you and move on to our next session.
I'll just repeat what I said, which is if you got questions, find us. We want to talk. Like, that's great. Like, we love helping give you information to help guide your journey. It can be intimidating to figure out what you want to do when you're in high school, and so we're happy to be a help to anyone.
And it's never too late, right? Like,
Yeah.
Just determined to be a lifelong student. And I don't mean you have to be in school for your whole life, but keep learning. And then most of us have done this to find our career path. That's normal and acceptable. Don't be intimidated. Just do the next thing. And then the view will change. And if it doesn't fit, you can find something else. And Stephen and I and anyone else I know would be happy to help. So